Hi guys, welcome back. We're going to talk about ectopic pregnancy. Ectopic pregnancy means pregnancy that is occurring in not in the normal place, right? You should be having the uterus, that is where the product of conception should be here. If it is occurring anywhere other any other place, it's known as ectopic, right? Ectopic means not from the normal site. Remember, if the normal incidence, the normal prevalence of ectopic pregnancy is around 1 to 2%, that means out of 100 pregnancy, around 1 to 2 pregnancy will be occurring in ectopic area. Now if you have done ART, this means if you have used any other technology in order to assist the reproductive technology, that times you will be having an incidence of around 5%. Please remember, if you had a previous history of one ectopic previously, you'll be having a 15% chance. If you had two ectopic history previously, 30% chance, right? Why in ART the chances increases? I'll tell you. We are giving you drugs to increase the ovulation. That means we want 2-3 ovulations to take place, more ovulation to take place, right? We are injecting the sperm. Sometimes we want to inject two ovum inside, so we are wanting more amount of ovulation, more amount of sperm, more amount of eggs come and they fertilize, right? So please remember, two if there is two pregnancy taking place in ART, it's okay. If it is three or more, it is known as high risk pregnancy. It's a side effect. Okay, very important. Artificial reproductive technology, if it is having three or more, it's a side effect. Two, acceptable. Okay, so now please remember, what is the etiology? What is the etiology or causes of ectopic pregnancy? Very important is PID. Since the mother is almost pregnant, not very much pregnant, right? She is not very much pregnant. That's why we call it PID. If the mother was pregnant, then we will tell again chorioamnionitis. Chorioamnionitis and PID is same thing. Okay. Again, previous history of ectopic, very well said. And history, treatment of infertility. If you have a history of infertility, clinic exposure and all that, very high chance. IUCD, very important. IUCD will not allow the ovum and the zygote, all these things to attach here. So it will try to say, don't come here, I'll throw you out. So the body will try to have a growth here as well. Okay, very important. If you're taking progesterone only pill, very important. Then you have any tubal surgery, because you are going to fertilize in the ampulla on the tubes here. Sperm is going to come here, the ovum is going to come here, they're going to fertilize here. Now they are fertilized. Now again they will travel down here. How it is going to travel down? By the action of peristalsis. If the peristalsis action is stopped, that means it can't, so it will try to grow up here again, right? So we next one, we have tuberculosis, very important, and history of endometriosis. Right, what is endometriosis? There's blood here whenever there's period, right? In order to throw out the blood, the uterus contracts, right? So some blood comes out and some blood goes back to the fallopian tube. Is it normal? It is 100% normal. Around 90% of patients will be having endometriosis, but the immune system is good, it has been reabsorbed. If your immune system is not good, it will go there, will give you pain and can cause infection, right? So endometriosis is this inflammation, right? Very important. So right, so now we're going to talk about what is the common site for the ectopic pregnancy. We obviously know it's tube, right? The fallopian tube. If you need to know where exactly in the fallopian tube, it's in the ampulla. Ampulla is a place where sperm and ovum comes and fertilize. Okay, now remember, when is the ectopic pregnancy is going to rupture? All ectopic pregnancy is not going to rupture. All the patient that is coming with the history of ectopic pregnancy, sorry, with the presentation ectopic, is not definitely that they have been ruptured, right? So remember the time of rupture. Very important is the ampullary area. That is the ampullary area, very common area. This area, the time of rupture will be 6 to 8 weeks. Okay, and if we need to say the corneal area, it is around 12 to 16 weeks, and if it is isthmus, it is around 4 to 6 weeks. Okay, very important. Remember, is that right? Okay, so now just to give you an idea, this is why it will rupture in the first place, because there is not enough amount of blood supply to sustain the growing fetus, and also the growing fetus will put pressure on the tubes and it will rupture. Okay, so this is the uterus. Okay, you are having the endometrium here, you are having endometrium, you are having the fallopian tube somewhat like this, Okay, you're having the ovum, oh, sorry, the ovary. Okay, now here you're having the corpus luteum. Okay, remember this fetus is going to produce HCG. Okay, human chorionic gonadotropin, right? This is structurally similar to LH. Okay, now it is going to support the corpus luteum. Remember, it is a chain process. Okay, it's going to support the corpus luteum. This corpus luteum will again produce progesterone, which is going to maintain the pregnancy, right? So this progesterone is itself also producing, maintaining the endometrium of the uterus, right? So fetus is producing HCG. HCG is producing, supporting corpus luteum. Corpus luteum is supporting progesterone, which is supporting the fetus. After 12 weeks, where the placenta is being produced, that time it is producing by the placenta, not by corpus luteum anymore. Okay, from 6 weeks to 12 weeks completely takes over at around 12 weeks of gestation. Okay, now since it outgrows the blood supply, this dies. So if it dies, it's not going to produce HCG. So no corpus luteum, no progesterone, support all gone. So the mother will have bleeding coming out. Okay, spotting, bleeding will be there. Very, very important. Okay, so now we're going to talk about some clinical features. Clinical features. Very, remember, it generally it will be kind of relatively middle-aged patients, because it's more commonly seen in infertility. And where is infertility more common? In middle age, right? So young age, less chance. Infertility chances less. So infertility, and if she gives a history of assisted reproductive technology, if she gives a history of assisted reproductive technology or technique, and she was saying that, okay, I was having infertility, very important, you have to think of ectopic pregnancy. And if you see she is in collapse, she is the shock, the pulse rate is very high, volume is very low, the blood pressure is less, very high chance that it might be ectopic pregnancy. But not all ectopic pregnancies are ruptured ectopic pregnancy. Okay, so very important is, remember, there will be pain, okay, then there will be bleeding via vagina. Okay, there will be shock, then there will be syncopal attack, syncope. Okay, along with this, you have to see, since there is bleeding, if it ruptures, right, you will be having bleeding in the abdominal area, right? So that is the reason we say hemoperitoneum, that is hemoperitoneum, blood in the peritoneum, right? So hemoperitoneum, it will be Cullen sign and Turner sign. Cullen sign is the around the umbilical area. Okay, there will be discoloration. Okay, there will be bruising. And the Turner sign, on the flank of the patient, you will be having discoloration. Okay, it can also be seen in abdominal trauma, right? You can also sometimes see in pancreatitis, also very, very important. But the main thing here is that you have to remember why hemoperitoneum. If trauma, anything, there is blood coming into the hemoperitoneum, you will be able to see Cullen sign and Turner sign. How do I remember Turner sign? Because I need to turn the patient, because the bruising will be on the flanks, so you need to turn the patient to see it. So if you are able to see bruising there, that is known as Turner sign. If you see around the umbilicus, it is known as Cullen sign. Very, very important. Okay, and also the pulse will be increased, the BP will be reduced, the pulse volume will be reduced. So this all symptoms will give us an idea that the patient is having ectopic pregnancy. Okay.